Hi, everyone. My name is Chase Maury. I'm a fourth year medical student, and welcome to this anatomy imaging walkthrough. In this podcast, we're going to review the structures from your ID list for the superficial and deep neck using CT and X ray. The first thing I'd like to do is orient you to what we have on our screen. On the left side of the screen, I have an axial window, and on the right side of the screen, I'd like you to reference this sagittal window to see exactly where this axial view comes from. This green tracker line here corresponds to how high or low this axial slice was taken. So you can see that this axial slice was taken right here. All right, so there are 7 cervical vertebrae, and this slice right here is denoting the C4 vertebra. The anterior-most portion of a vertebra is the vertebral body. It's shaped like an oval. Laterally flanking the vertebral body are these bony prominences called the transverse processes. And posteriorly is the largest bony prominence of the vertebra. This is the spinous process. In this axial view, it may look like there are some disconnections here, but that's just how the slice is kind of configured. And as I scroll, you can see that all these things are connected. And when you connect all these portions of a vertebra, the body, the transverse processes, and the spinous process, it forms a ring. And in the middle of this ring is a hole called the vertebral foramen. This is a very important foramen. This is where your spinal cord sits, surrounded by CSF and the dural membrane. You may recall from previous anatomy labs in your MSK modules that the cervical vertebrae have some unique characteristics. And one of those is that the transverse processes have foramina themselves. These foramina are called transverse foramen. And within the transverse foramen, it's important to know that there are blood vessels traversing here. So you can see this hyperdense bone with this less dense vessel here. This is the vertebral artery. And vertebral arteries are very important blood supplies from your heart to your brain. All 7 cervical vertebrae have transverse foramen, but the C7 transverse foramen are so small that they don't actually transmit any arteries. So what this means is that vertebral arteries course through C6 to C1 transverse foramen. Some other unique things with cervical vertebra to talk about are C1, also known as the atlas, and C2, known as the axis. So we're at C4 here, and I'll go ahead and scroll up towards C1, which is just below the base of the skull. All right. So here is C1, the atlas. You can tell it has this ring shape, very unique. It doesn't really have a vertebral body here in the front. This portion of bone right here is actually the dens, or the odontoid process of C2, protruding superiorly. So if I follow it down, you can see that it connects here to another vertebral body, a separate one. This is C2. To really appreciate how much the dens protrudes superiorly, I'm going to pull up a coronal image here on the left and scroll far back into the spinal column. And you can see the dens here coming up from C2 right here. And then this is C1 atlas. There's not really a vertebral body to show with it. You can see this joint here with the dens protruding superiorly. When it comes to counting vertebra, the easiest way to do this is to look at lateral views of the spine. You can do this on CT, obviously, but it's really easy to do on a neck x-ray, which is typically what's ordered before any CT imaging, so you're more likely to encounter it in this manner. You can make out the C1 vertebra right below the base of the skull, and you can either count the vertebral bodies below it or the spinous processes here in the posterior part. So here's C1, C2, 3, 4, 5, 6. And then one thing that might pop out at you to give you a clue what vertebra you're looking at, this is C7, and it's going to have the most prominent spinous process, usually. In this picture, it depicts it as very prominent here in the back. One clinical correlate I think is fun to bring up here is X-ray acquisition dedicated to the odontoid process. This odontoid process is such a small piece of bone, and it's directly against the atlas. I showed you the joint earlier, and any bone is susceptible to fracture. In the case of trauma, the odontoid process can fracture and actually displace and compress your spinal cord, leading to some significant neurological deficits. Here's a picture of how you actually get this view. The patient's told to open their mouth widely, as almost as if we're instructing them to eat the x-rays, which is kind of funny, but it also demonstrates how cool imaging is. You can assess someone's spine through their mouth. And this image just shows a normal dens. There's no fracture here. But this image, you can see there's this lucent line here on the x-ray, and that's depicting a fracture of the odontoid process. Now we're going to jump into the vasculature for today's lab, and I'd like to first talk about the arteries that we need to name. And these arteries are not going to be the most complex vasculature that you'll see in your anatomy labs, but I do think they're super important because today we're going to be talking about the branches that come off the aortic arch and following those out a little bit more as they extend throughout the body. So let me pull up my whiteboard and give a very crude drawing of what we'll be seeing today on imaging. Here is a picture of the left ventricle, and here's the aortic valve that I'm drawing. The left ventricle will pump blood into the aorta. The aorta has an ascending portion, has the aortic arch, and then it will descend and distribute to the rest of the body inferiorly. The things that we're really concerned about in this lab are some of the branches coming off the aortic arch. You'll have a branch like this, something like this. Very crude illustration here, but there's a mnemonic that goes with this since these great vessels are so important in what they're supplying. The mnemonic is ABCs, simple enough. And what this stands for is A is going to be your aortic arch, that's this area here. B is the brachiocephalic artery. C is the common carotid artery. More specifically, this is the left common carotid artery. And S is the subclavian artery. More specifically, it's the left subclavian artery. You'll see eventually on the imaging that the brachiocephalic artery supplies the right common carotid artery as well as the right subclavian artery. The branches off the aortic arch, the left common carotid and the left subclavian artery come directly off the aortic arch. Hopefully that's a helpful mnemonic in case you get mixed up whenever you're thinking about this vasculature deep in the chest, the basis of where blood is going to be coming from the heart. You can always go back to your ABCs. To show you the vasculature on imaging, I'm going to be utilizing a CT scan with IV contrast, which is really going to make our vessels pop out on the screen. And to correspond with the image that I drew earlier, we're going to be looking at a CT and coronal view. The only issue with the CT that I'll say before we get into this is that it's a little bit higher than the heart. The heart would be somewhere around here. So if you could just hallucinate that the patient's heart is right here, we're going to be taking a look at the aorta. The aorta is this vessel here. Let me scroll through it to show you its ascending portion. So imagine a left ventricle down here. This is the ascending portion, then the arch, and then the descending. The first branch that we encounter on the arch is this one. That's the brachiocephalic artery. The brachiocephalic artery is not a very long artery. That's why it's also called the brachiocephalic trunk. At this point in the brachiocephalic artery, we can appreciate that there's a bifurcation. And at this bifurcation, the brachiocephalic artery becomes the right common carotid artery that will travel superiorly to supply the head, neck, and face. And laterally, it will be called the subclavian artery, which will go on to course through the arm. So as I scroll, you can appreciate this, following this is the subclavian artery, laterally. And superiorly is the right common carotid artery. One branch to point out on this right subclavian artery is the right internal thoracic artery. This teeny tiny branch here off the subclavian artery that's traveling inferiorly. The internal thoracic artery is also called the internal mammary artery. Keep your eye on that teeny tiny branch. It's going to course inferiorly, and I'll scroll and show you the path that it takes on imaging. So here it is here. As I keep scrolling, here it is there, and down. So that's the internal thoracic artery coming off the subclavian artery. So that's the brachiocephalic artery. Let me go back. That's the first branch off the aortic arch that we need to talk about. As I scroll, you can sort of see here that there's a second branch coming off the aortic arch. There's a lot of artifact in this image right here, so you can't delineate the connection very well. But I will tell you that this is the second branch coming off. So that is the left common carotid. You'll see it traversing up, and it will eventually supply the head, the brain. We'll talk about that one more in a second. All right. And finally, the last branch off the aortic arch. This is the left subclavian artery. And the left subclavian artery, it also supplies the arm, but there's this branch here on the subclavian artery, and you can see it traversing these transverse foramina in the cervical vertebra. That's the vertebral artery. So the vertebral artery that we talked about earlier comes off of the subclavian arteries. You can kind of see it here on the right as well. That's the right vertebral artery, and this is the right subclavian artery. So that's a really good picture to show where the vertebral artery is originating from. The next thing I'd like to do is go back and talk about the common carotid artery and trace it as it ascends to the head and the face. So to remind ourselves, this is the brachiocephalic. We're going to be talking about the right common carotid, that branch that's coming off superiorly. The left common carotid also does the same thing, but I just thought the right common carotid looks better in this image to show you the bifurcation of the common carotid artery into the internal carotid and the external carotid. One thing I'd like to point out is there's this large vessel lateral to the common carotid artery. This is the internal jugular vein. It's going to be really close to your common carotid artery because it's within the carotid sheath. The best way to look at the carotid bifurcation is to actually look at it in a sagittal view. So I'm going to turn our attention to the sagittal window on the right of the screen, and I'll scroll laterally until we pick up what's the most inferior portion of the right common carotid artery. As I scroll a bit more laterally, you start to see that the common carotid has split here into an anterior and a posterior branch. Like I said, this lower portion is actually the internal jugular vein. You can see it's not connected here, just the way the CT is using flat slices on curved vessels. I don't want you to get confused in this image that this would be the common carotid. That's actually the internal jugular vein, but this is the carotid artery. This anterior branch is actually the external carotid artery, and the posterior branch is going to be your internal carotid artery. You can tell this because the internal carotid is not going to branch outside of the skull. This is going to be a singular vessel. If I continue scrolling here, this is the internal carotid artery. It doesn't have any branches until it gets inside the skull, which you'll learn more about in your brain and behavior modules. Contrast that with this anterior branch, the external carotid artery. It's going to supply blood to the face, and it has multiple branches. So you can see that it's smaller, it's anterior, and it has a bunch of branches. Like I said, it's smaller because you can think of this as the internal carotid artery is more important. It's going to be supplying blood to the brain. The external carotid is supplying blood to the face, a little bit less important here. So to summarize really quickly, what I was saying was different between these two branches of the common carotid artery. The posterior branch is usually going to be your internal carotid artery. The anterior is usually going to be your external carotid artery. The internal carotid artery is going to be larger. You can think of it as a more important blood supply because it's supplying the brain. And then finally, the internal carotid artery has no branches outside of the skull, whereas the external carotid artery has multiple branches. Easy way to remember this is that I for internal looks like it's one single vessel, whereas E for external looks like it has multiple branches and fingers extending out from the vessel. One last time, I'd like to show the carotid artery bifurcation in an additional view, and this is going to be the axial view, which I have on the screen on the left. I'm using a different program to show this, just because I think it shows up better in these images. But this program, unfortunately, doesn't have a tracker line that you can orient yourself to where this axial view is, but I'll go ahead and try to draw one of my own here on the sagittal on the right. So this axial view would probably correspond to somewhere right here, maybe a little bit higher for this axial view. I can tell that because this is the patient's chin, and as I scroll a little bit further, you start getting into the patient's mouth. But the thing I wanted to show was the common carotid bifurcation. I'll go ahead and point out that these vessels right here are both common carotid arteries. As I scroll higher, you start to see that they split right there, okay? And the anterior split is a little bit smaller than the posterior split, once again showing the external carotid and the internal carotid arteries at the bifurcation. I keep talking about this bifurcation because it's an important clinical correlate associated with it. The blood flow to the brain is largely, it's one of the greatest supplies is the carotid artery. And at the bifurcation, there's a lot of blood flow turbulence. Anywhere in the body that a vessel bifurcates or branches, it causes a lot of turbulence in blood flow. So this turbulence can actually damage the blood vessels and predispose you to developing atherosclerosis, and that atherosclerosis can cause stenosis or narrowing of those blood vessels. When the blood vessels are narrowed in the common carotid artery, your brain doesn't get enough blood flow to it, and this can lead to a stroke. So the most common site for carotid artery stenosis, which is something you have to think about when a patient has a stroke, is actually at the carotid bifurcation due to that turbulent blood flow. Now we're going to move on to the veins. We said earlier that the internal jugular vein is immediately lateral to the carotid arteries within the carotid sheath. So on this axial view, if this is the carotid artery, this must be the internal jugular vein. And if there's an internal jugular vein, that begs the question, where is the external jugular vein? The external jugular vein is the lateralmost vessel on this image. In between the internal and the external jugular vein is this soft tissue here that's not as bright as bone. It's not as bright as a contrast-enhanced vessel, but it's not as dark as something like fat or air. That is a muscle. This muscle is the sternocleidomastoid muscle. It's the delineator between the external jugular vein and the internal jugular vein. If we trace the external jugular vein inferiorly, so I'm scrolling down, right, we see it's still superficial to the sternocleidomastoid. It has some branches, but we don't need to know those right now. And eventually, take my arrow off. Eventually, it'll dump into a larger vessel just underneath this bone here, which is the clavicle. So this is the subclavian vein. An important thing to point out with the subclavian vein is the muscle that actually separates the subclavian vein from the subclavian artery that we talked about earlier. Kind of like how the internal jugular vein is separated from the external jugular vein by the sternocleidomastoid muscle. In this case, however, the muscle is called the anterior scalene. So as we look at the subclavian vein, starting here, I'll scroll and show you that it's coursing kind of in this direction here. To point out the subclavian artery, it's this vessel that's brighter, coursing a little bit deeper than the subclavian vein. The anterior scalene muscle has the subclavian vein running superficial to it, and the subclavian artery running just deep to it. That's here. The scalene muscles are a group of three muscles, the anterior, the middle, and the posterior scalenes, that mainly serve as anatomical landmarks as opposed to functional muscles. Like I said, that's the anterior scalene, and I'll scroll up to show the middle and the posterior a bit better. So here's the anterior scalene, here's the middle, and it's difficult to say, but as we move posteriorly, this is probably the posterior scalene. It's a very small muscle. Moving back inferiorly towards the heart, I'll turn our attention back to the internal jugular vein. You might notice that it's a little bit more anterior when we looked at it at a slice that was more superior than this. But that's the internal jugular vein in this slice. And once again, here's the external jugular vein and the sternocleidomastoid kind of separating those. But focus your attention on the internal jugular vein, and I will scroll inferiorly towards the heart. Eventually, the internal jugular vein will join the subclavian vein. So here's the external jugular vein, eventually becoming emptying into the subclavian vein. You can see the internal jugular vein also joining the subclavian vein. At this point, when the internal jugular vein and the subclavian vein join together, the vessel is now called the brachiocephalic vein. There's a left and a right brachiocephalic vein. Eventually, they join together to become the superior vena cava, which will dump into the heart. To round out our ID list, I'm going to start talking about the superficial structures of the neck. Right now, our axial slice is deep, just above the heart. I'm going to scroll up to the patient's chin, and we'll start from there and scroll downward. So let me scroll up here. All right, now I'm starting to see the patient's chin again. The first bone that I'd like to call your attention to, the first structure, is this horseshoe-shaped bone, deep to the chin, ever so slightly, maybe inferior to the chin, but anterior to the patient's airway, this black, very dark circle on CT. So this is the hyoid bone. And it's also really easy to see on the sagittal view. It's just this really dense bone kind of floating in space. Moving a bit inferiorly from the hyoid bone, as I scroll down, you start to pick up the thyroid cartilage right here. It kind of comes to a point here in front of the airway, but it's not as bright as a bone would be. It's also a little bit more bright than the surrounding soft tissue. That's kind of how cartilage looks on a CT scan. One thing to point out is that thyroid cartilage does not completely encircle the airway. It only has this anterior component. That is to say, in contrast to cricoid cartilage, which as I scroll down, so let me get rid of this arrow. As I scroll down further, there's this cartilage that you can see it kind of encircles the airway here. There's cartilage. Oh, I'm sorry, I'm trying to draw a line here. All right. There's cartilage that completely encircles the airway. And to orient you to how deep we are on the scan, we're probably about at this level of the patient's neck. I really want to emphasize that this cartilage does completely encircle the airway because this is the only cartilaginous structure that does this. Even tracheal rings are C-shaped without a posterior connection. The tracheal rings would more likely be a C-shape, kind of like the thyroid cartilage compared to the cricoid cartilage, which completely encircles the airway. As we move even more inferiorly, so scrolling down, right, you start to see this bright area here. This is actually the thyroid gland. And the thyroid gland is really nice on any contrast CT because the contrast that's used for CT imaging is iodine based. And the thyroid gland loves iodine. It's an iodine sponge. So it pops out pretty nicely on imaging. You can even see it here on the sagittal view. It has its own intrinsic contrast since it loves to soak up iodine. That concludes the superficial and deep neck imaging ID list. I hope it was helpful and clear. I strongly encourage you guys to learn the vasculature well, since this lab includes the major highways blood takes from the heart to the brain. Here is my email with any questions or feedback on how I can improve these podcasts. I hope you guys take care and good luck studying.